Can children and young people under the age of 16 give informed consent to medical treatment for gender reassignment? A legal case will be lodged this week which will test that. It centres on puberty blockers. Now, these are medicines that pause puberty, and they're given to young people who are struggling with their gender identity. And effectively, they block the hormones, testosterone and estrogen, that lead to puberty-related changes in the body. So they might stop things like periods and breast growth, or voice deepening and facial hair growth. Susan Evans was a psychiatric nurse at the Tavistock and Portman NHS Foundation Trust, which runs the UK's only NHS Gender Identity Development Service. She is bringing the case alongside Mrs A, the mum of an autistic 15-year-old girl who's on the waiting list for the Tavistock clinic. Ms Evans explained why she was bringing the case.
100% virtually of the children that they treat on puberty blockers don't have this pause for thought and a period of time to think about things. What they actually do is they always progress, very often with very few other appointments for any psychological support or work, and they then move on to cross-sex hormones.
And cross-sex hormones, just to explain to our audience, means what for a young person?
So for a female, that would involve them having large doses of testosterone. For a male, they would be given doses of estrogen, and there are probably correct terms for those, but essentially that's what the two drugs are. And they would, for females, cause them to really develop more male characteristics such as body hair. Their voice would deepen, they will stop menstruating, and very often. And then for males, they would have softened features. Sometimes they develop breasts. So their male characteristics start to diminish.
And is that reversible?
No, that's not. No.
But so I understand the link you are making in your case, which is that all the young people and children who consent to taking puberty blockers, which is pausing puberty with the idea that it gives a young person time to consider and think about whether they really want to continue on that particular path, you say all of them progress to cross-sex hormones. That is not reversible. However, your issue is with the puberty blockers, and that is reversible.
So the Tavistock and the UCL will say that it is reversible. But the experts that I've spoken to have said that we don't know for certain that's the case. There is a delay in bone growth. There is potentially some changes that will go on in the brain development. And because there are no outcome studies of any length, the Tavistock are not very good at doing follow-up studies, you can't safely say that this is a fully reversible drug. And the other point is that you're setting children on the pathway for something that I think as children they don't understand. You know, this will have a huge impact on their adult life.
So what do you want, Sue Evans?
OK, I would like to see children given a really good psychological support service. I would like them to be treated locally in their areas, because what happens at the moment, because everyone's so fearful about this area of gender identity, GPs and local CAM services swiftly pass on the patients to the Tavistock. And I don't think that's necessary. I think that the children could be helped and treated in their local areas and be given psychological support, as can the families, because everyone is very distressed when this starts to occur within the family.
But are you hoping to stop under 16s, perhaps under 18s, from making decisions about whether they want to pause puberty?
I would like to see that happen, because as I said, I think that children don't understand fully the consequences of what they're doing.
That is a huge generalisation. You will have come across some very mature 12-year-olds, 13-year-olds, 14-year-olds, 15-year-olds who can make those decisions.
I don't think, and I think anyone who's got teenage children or children of 9 or 10, I don't think that these children are very sensible children. And don't misquote me here, please, because they may be very clever children and very mature for their age, but they are in a distressed state. And what you know is, for example, when a 12-year-old develops an eating disorder, they may be cognizant, they may be able to talk very rationally, apparently, to you about the world and what goes on in their life. But there is an area of their thinking which is affected by this distress. And so what I'm saying is that this gender identity confusion is very often a symptom which is produced from all sorts of confusions, very normal confusions in some cases, but also 30% of these children have autism that we know about. A large proportion of them may have suffered some form of trauma. They may have experienced sexual abuse. They may be homosexual and be struggling with that, or their families might be struggling with that, and it seems unacceptable, and therefore transiting could seem like a solution. So they may be able to talk rationally about it and say, yes, I understand, but you've got to see that both they are not in the state of mind very often in order to fully understand. And how I know this is because I talk to detransitioners, and detransitioners will say, I absolutely said I wanted it, I was clear about it, I was firm in my wish to trans, but I wish that mental health services and psychologists had withstood that pressure from me.
I understand, but let me ask you this. How much distress could a young person experience? And you know what the rates of self-harm and suicide are for young trans people. How much distress would a young person experience if the option of pausing puberty was removed from them?
So the other thing to say is there's been a very clever campaign, I have to say, but again, I think the research on this is presented in a certain way by the trans lobbies, really. The fact is that research in other areas, and some of these, my experts who are going to give witness statements, have much larger research studies to say that actually these children are, yes, very distressed and often suicidal, but transing actually doesn't have any real effect on that state of mind. So often people who trans will still be very depressed, distressed and suicidal. So again, that is often peddled as a known fact, but actually I'm going to hopefully in court prove that that is not the case.
Okay. I mean, for what it's worth, I have met multiple young trans people, some who have fully transitioned, who are so much happier. Anecdotal evidence, of course, I accept.
Yeah, so that's the other thing to say, because I know that there will be some children for whom this is the case. And I've met some people who have trans, and I speak to some who are happy with that decision, and I absolutely would support them in adulthood to go on and live their life as they wish. This is not about saying nobody should trans, but what I'm saying is for young children, it's clear that many of them will have very strong feelings that something is wrong with them and their bodies, but it's more important that we give them the time and space and the psychological expertise and support locally in their areas to help them withstand that distress. So, you know, please hear that I'm not saying never to anybody, but I'm saying let's not medicalise a whole generation of children who may well live to really regret the decisions that they've been allowed to take because medically we were not responsible enough in their younger years.
Susan Evans. Well, the Tavistock says the assessment period before puberty blockers usually takes 6 months or more over a minimum of 4 to 6 sessions. And at the end of the assessment, it may be possible to confirm or exclude a diagnosis of gender dysphoria. The clinic adds that their service has a high level of reported satisfaction and was rated good by the Care Quality Commission, and that they abide by international best practice guidelines.